Air pollution is now the second leading global risk factor for death. This shocking data comes from a UNICEF-backed report in collaboration with the Health Effects Institute. The numbers reveal a grim reality. In 2021, air pollution killed 8.1 million people, translating to about 22,192 deaths every day. Even more heartbreaking, one child dies every minute due to air pollution.
The statistics are stark. The last report that was released on the state of global air quality showed that there were a little over 7 million deaths from air pollution related diseases.
The biggest culprit is Ghana's aging, highly polluting fleet of vehicles. A sea of cars crawl bumper to bumper, thickening the air with harmful particles and gases. It's rush hour, a bustling time when everyone is on the move, crowding into public transport vehicles to reach their destinations. For those navigating this daily ordeal, the respiratory strain is palpable, with each breath laden with potential health risk.
It's not easy. It's a difficult moment, especially something that relates to your breath. You can't breathe as you do so often. It's challenging breathing.
Reuben Alexander Otu has asthma, a life-threatening illness that constricts airways. He's one of a growing number of Ghanaians with respiratory illness and a range of ailments, including heart conditions that doctors say are worsened by toxic air. Otu has to think all day, every day about avoiding triggers.
You encounter different kind of cars with the smoke from their exhaust pipes, very bad, and they are not the best.
70% of daily commuters in Ghana use privately run minibuses known as trotros, which are often older, higher emitting vehicles.
We give it to them to wear. Okay. The idea is to wear to where their nose level is. Okay. Just to see whether what they are breathing in will be the same as the sensor is speaking.
Researchers at AfriSet, an air quality research organization, are studying commuter exposure during rush hours using wearable mobile sensors. The preliminary results, according to James Nimo, a research associate at AfriSet, are startling.
From the raw, we could see that people are exposed to poor air quality, I think from 40 milligram per meter cubic to 100 milligram per meter cubic, which is above the Ghana EPA standard. So rush hours are around 80 milligram per meter cubic, which is not good for human health. So from the graph, you could see that from between 6 and 10, we have some peaks. Between 6 and 10, we have some values, the peaks, right? It's above that, and then in the evening, right, it can go up to almost 100 milligram per meter cube.
Ghana's transport sector, made up of 3.2 million vehicles as of 2022, is the leading producer of air pollution. Pollutants from the transport sector alone account for nearly 40% of the country's air pollution, dwarfing the contributions from industries at 11% and households at 10%.
I do not get a straight car to work, and I don't have a car at the moment. So what I do is that I join one car to Kaneshie, then from Kaneshie I join another vehicle from Kaneshie to Tema Station, then just a walking distance to my office.
Chief reporter at Ghana News Agency, Edward Aqua, was among the few volunteers on the project, documenting his daily commute from Abelinkpe to Accra Central. According to sensor data, pollution levels range from moderate to unhealthy for sensitive groups on average. However, during several segments of the trip, the pollution spiked to severely polluted, posing risks even to healthy individuals. Edward admits to feeling a deep sense of helplessness after witnessing these alarming results firsthand.
It was very disturbing because that is something that invariably I find myself in that way because that is my natural environment. And it appears that apart from you protecting yourself personally by way of nose mask, you cannot do anything much to stop the pollution, because your natural environment, your natural routine. For me, it's very, very disturbing because it's a daily thing and you cannot go without it.
The WHO estimates 28,000 people die prematurely every year in Ghana as a result of air pollution. Between 2020 and 2023, the Ghana Health Service's own non-communicable diseases control program documented over 230,000 new cases of asthma. Epidemiologist at the University of Ghana, Dr. Reginald Kwanzaa knows why.
Air pollution levels are consistently moving up. There are several factors that account for this. I think one of the things that is very obvious is emissions from vehicles.
The good news is that there are things people can do to reduce their exposure. Dr. Carlos says the easiest is to wear a good mask.
Within the limitations of some of these protective equipment like the respirators, the N95, at least you can reduce the black carbon and then other particulate emissions.
Desmond Appiah, country lead of Clean Air Fund, insists that enforcing air pollution laws is essential to protect ordinary Ghanaians.
In the Ghana situation, we have some laws, but there's a lot more that we need to be doing to be able to push the needle. The challenge, large challenge that the clean air field faces is that the quality of the air is not seen. So we call it like a silent killer. We are in a room, we are breathing air, but we may not see that this is the state of the quality.
AfriSet, led by Dr. Alison Felix Hughes, plans to conduct extensive research across diverse socio-economic backgrounds and geographic locations to identify environmental hotspots nationwide.
Looking at the future, what we intend to do is to do a more detailed study over a longer period, looking at different groups of persons, students, workers, market women, and different groups, how the level of exposure is to these various groups as they move to and fro every day.
The EPA and other government agencies, including Parliament, are actively exploring various regulations aimed at strengthening air quality laws. This story was a collaboration with New Narratives. Funding was provided by the Clean Air Fund, which had no say in the content of the story. For Joy News, Michael Ashale.
Got it.